In this lecture, we will discuss the internal cranio-cervical ligaments, their labels, and the atlantoaxial and occipital joint anatomy and their clinical. In the label 1, you can see it is the capsule of the atlanto-occipital joint. The label 2 is the capsule of lateral atlantoaxial joint. It is the present on the lateral side. And the label 3 is the capsule of zygophyseal joint C2 and C3. These are the capsules. The label 4 you can see here is the cruciate ligament. Cruciate, it means it crisscross. This is the cruciate ligament, and the label 5th is the alar ligament. This is the alar ligament. The label 6 you can see here present on the posterior side, so it is the posterior longitudinal, its lengthwise increase, longitudinal ligament. And the label 7 here is the pectoral membrane. Label 1, 2 and 3 are the capsules. Label 4 is the cruciate ligament, 5th is the alar ligament, 6th is the posterior longitudinal ligament, and the 7 is the pectoral membrane. Next we will see the atlanto-occipital joint is a biaxial. It means it rotates a movement in two axes. Biaxial condylite synovial joint between the atlas and occipital condyles. It permits the flexion and extension movement as when the head is nodded up and down, and some lateral bending. The atlantoaxial joint are the uniaxial. Atlanto-occipital is biaxial. Atlantoaxial is uniaxial synovial joint. They consist of plain joints associated with the articular facet and a medial pivot joint between the dents of the axis and anterior arch of the atlas. Atlantoaxial joint permit the atlas and the head to be rotated as a single unit as when the head is turned from side to side. These joints are reinforced by the ligament. There are the ligaments we will discuss, that is the cruciate and the alar ligament. The alar ligament limit the rotation of the neck. Next we have a clinical osteoarthritis. Osteoarthritis is the most common form of arthritis and often involve erosion, means damage of the articular cartilage of the weight-bearing joint, including the cervical spine. Extensive thinning of the intervertebral disc and of cartilage covering the facet joint can lead to the hyperextension of the cervical spine and the narrowing of the intervertebral foramen, and the potential for impingement of the spinal nerve increase due to the narrowing of the intervertebral foramen, because the nerves existing the exit from the intervertebral foramen, and this impingement is increased when it is narrow. Okay, this is the clinical. The labels we will discuss: atlanto-occipital joint and atlantoaxial joint, anatomy discuss, and last is the clinical. I definitely sure you like this video. Thank you.